As a nurse, one of the most common patient group that you would care for are older adults. So understanding their unique needs isn't optional, but it is essential for safe and compassionate nursing care. Hello everyone and welcome back to the channel. My name is Jubril Amzart, a registered nurse and a nurse educator. In this video, we will discuss about an important topic that you need for both understanding and clinical practice. Let's begin. By the end of this lesson, you should be able to define geriatric and what geriatric nursing is. You should be able to explain why geriatrics is important in nursing. And you also be able to describe the key characteristics of older adults. And lastly, for these objectives, you will be able to identify nurses' role in geriatric care. Now, what is geriatrics? Geriatrics is a specialized branch of medicine and nursing focused on healthcare of older adults. It aims to promote healthy aging, prevent disease, and also manage complex health needs holistically. So when we say geriatrics, we mean the care and support for the health of older adults. What are the key terms that you can find in geriatrics? Now, some of these key terms that we have in geriatrics are geriatrics itself, gerontology itself, and also gerontological nursing itself or geriatric nursing itself. Now, geriatrics on its own focus on preventing and treating diseases, whereas gerontology is the scientific study of aging, the study of the aging process. And when we say geriatric nursing, this is where we care and we give nursing care to the older individuals. For recap, geriatrics focus on treatments, gerontology focuses on studies, and then lastly, gerontological nursing or geriatric nursing focus on nursing care. Why do we find geriatric to be important in nursing? Now, one of the key reasons are older adults population is increasing globally. The number of adults, older adults that are aging and still surviving is in increase, and this is why it is important for us to understand how to care for them. Another reason why we see geriatrics important in nursing is because of older adults are often living with chronic illnesses. They are very susceptible to diseases, infection, and this is why it is important to be able to care for them and also promote their own health. Now, another important is we nurses do care for older adults in all settings. So in every department or every ward you are in as a nurse, you would always care for an older adult that has been admitted in that ward or department. What we need to know here is geriatric knowledge would help to improve your nursing quality. So you being able to have geriatric skill as nurse only improves your quality in providing care for your patient. Aging affects individual differently. Each and every individual ages differently. No individual ages in the same way. Each and every one of them would have to age differently. Now, what are the characteristics that you would see in these older adults when they are aging? The physical health changes in older adults is one of the characteristics that you would see in the older adults. And the physical changes in aging, what you could mostly see is there is reduced muscle strength and bone density, there is decline in vision and also hearing for the older adults, and you would even see weakening of the immune system. So what we need to know is the physical changes that occurs during aging could be an increase of health risks for the older adults themselves. Now, another characteristics that we spoke about is psychology. The psychological changes that we have in these older adults, it's slower cognitive processing. There is mild forgetfulness may also occur. There could be increased risks of depression for these older adults. And therefore, mental health support is essential. The last of the characteristics is the social change. And some of the key things or few things that you can see in social changes, retirement and reduced income. When they are retired, they don't tend to earn as they used to earn before. So there's a reduced in earning, and then these alone, it's a social changes for them, whether positively or negatively to the older adults. So loss of family and friends. So some older adults are still living, and then they are seeing their family members and their friends passing away, dying, whereas they're still living. Some would even see their kids dying. So these are some social changes that you can see that will occur within these older adults. Now, risks of social isolation. Now, In the globe generally, we mostly see that most adults are mostly what isolated and neglected. They tend to be left alone. They tend to be, I won't say neglected, but they tend to be left alone, be isolated, and most of them do live their lives most of the time alone. So all these are social changes that you would see in older adults that would need your attention as nurses. Now, social support would always help to improve the well-being of these older adults. What are the principles of geriatric nursing care? Now, one of the key principles here is when we are treating these older adults, we need to treat them holistically. We need to provide holistic care for these patients. We need to look at them psychologically, physically, socially, and even mentally. We need to treat them in a whole when caring for these geriatric patients. Another principle in geriatric nursing care is individualized care. We did mention that aging for each and every individual is different. No individual age the same way. They age differently. This fact that they age differently, when we want to care for them, we need to individualize this care so that we would know the need or the unique need for each and every older adults. Another principle here is promotion of independence. When we care for them, we need to promote their ability to be independent, their ability to be able to do most of their daily lives that they used to do when they were a bit younger. Another principle to follow when caring for these older adults is safety and dignity. We need to ensure that when caring for them, they should be in safe space, safe environment, and then they should be respected by giving them as much dignity as they deserve. And lastly, in the principles today, is family involvement. So since we believe that most of these geriatric patients often live alone, they are mostly isolated. When we are giving care to them, we need to involve their family members. We need to point out these important parts of the geriatric patient themselves to their families so that they won't be isolated as it is common globally nowadays. So we need to ensure that we involve their families to be able to support them when it comes to social aspect, health for these older individuals. And then what do we have to remember here is that care must be respectful and patient-centered. So when we are providing care for these older adults, it has to be with respect and it has to be patient-centered. Now, what are the common health problems that you mostly find in the older adults? Now, some of the common health problems that you mostly find in older adults, few examples are hypertension and heart diseases, due to the fact that blood vessels are losing their abilities or their functions as they used to when these older adults are much more younger. Another health problem that you can mostly see in these older adults is diabetes, arthritis, or osteoporosis. Another common health problems that you would see in older adults most commonly is going to be vision problems and also hearing problems as they age. So chronic illnesses is common in older adults. Geriatric syndrome. What is geriatric syndrome? Now, when we say geriatric syndrome here, as the definition of syndrome implies, this is when we have multiple symptoms of different causes affecting a single individual. So in this case, we refer to it as a syndrome. Now, a geriatric syndrome is when we have multiple symptoms of different causes affecting the older adults. Now, what are some of these syndromes that you would see in the older adults? You could see easily in older adults falls and frailty. So one of the key symptoms that you will see in older adults is them falling easily. Another symptom or another syndrome rather that you see in older adults is incontinence. Incontinence is the inability for them to be able to retain either their urine or their feces. So some of these older adults find it difficult to be able to retain this urine back or these feces back in them, and they easily what? Let it come out. So this is another syndrome that you can see in older adults. Another one that you can see is delirium, confusion in older adults. So older adults psychologically do develop confusion in them. So this is another syndrome that you can see in older adults. And then one of the syndromes that I also added here is pressure sores. So pressure sores is also one of the syndrome that you can see in an older adults. Now, all of these symptoms, when you find all of them in an older adult, we refer to it as geriatric syndrome. This is when you have, because as we can see, all of the symptoms that we have mentioned are of different causes. So the fact that all of these symptoms from different causes is affecting a single individual, an older individual for that matter, is what we refer to as the geriatric syndrome itself. So these conditions have multiple causes. All of them are not from one causes. So when all of these caused symptoms are affecting a single older adult, we refer to it as a geriatric syndrome. Now, what is your role as nurses in geriatric care? What do we expect from you as nurses to these older adults? Now, one of your role as nurses is to ensure that you provide a proper health assessment and monitoring for these older adults. Another role as nurses is to ensure that you give medication to your older adults and you also manage their medications. Another role as nurses is to ensure that patient education is being manifested. You need to ensure that you educate these patients to be able to be knowledgeable of their own health conditions and how to improve their health condition. Another role as you nurses is to support with daily activities. The activities of daily living that these older adults could not fulfill, it will be your role as nurses to help them fulfill these activities. And lastly, in your role as nurses is to ensure that you always give advocacy for your patient. And also, in conclusion, geriatrics is essential in modern nursing practice. So understanding older adults improves care quality and promotes healthy aging. Geriatric prepares we nurses for a real world care. Thank you for watching this video. If you're a nursing student, remember to revise this topic and apply during your clinical practice. Don't forget to like, subscribe, and share this video to your classmates. In the next video, we will continue with the next topic. See you then.